Have you ever wondered if your evening habits might be silently threatening your survival? This might sound dramatic, but statistics from the Centers for Disease Control and Prevention show that more than 70,000 elderly Americans die in their sleep each year. What's most disturbing is that many of these deaths aren't simply age-related but stem from preventable sleep behaviors that individuals rarely question. With advancing age, our bodies develop heightened sensitivity to minor alterations. Past 60 years old, your cardiac system, cognitive function, and breathing mechanisms all become increasingly vulnerable. Rest patterns transform, physical strength decreases, and the hazards tied to apparently innocent bedtime practices expand dramatically. Nevertheless, most elderly individuals persist with identical habits they've maintained for decades, oblivious that these routines might be secretly compromising their wellness and possibly reducing their lifespan. Which hidden perils are concealed within your nighttime routine? What common sleeping behavior triggers more medical crises than any other? Which simple modifications can you make immediately to shield yourself and loved ones? We're about to investigate 7 widespread sleep practices that have already taken numerous senior lives this year. The second behavior represents the most severe threat, demanding your complete attention. We'll also share appropriate measures to guarantee secure and peaceful rest. ## 7 lethal sleep behaviors to eliminate ## behavior number 7. Overhydrating before sleep. Will begin with a habit frequently overlooked because it seems beneficial: water consumption. Adequate hydration stays absolutely critical for all individuals, especially seniors. Water feeds every cellular structure, regulates body temperature, facilitates digestion, and keeps joints functioning smoothly. Nevertheless, there's a crucial consideration. While proper hydration remains essential, consuming excessive liquids directly before rest can genuinely threaten your wellness in surprising ways. Aging transforms how our systems handle fluids. Kidneys, which filter blood toxins and maintain fluid balance, grow less capable with time. Concurrently, bladder storage capacity diminishes, and signals indicating restroom needs become more intense and frequent. This indicates that consuming a substantial glass of water, tea, or juice within 1 to 2 hours before sleep significantly increases your likelihood of awakening during nighttime for bathroom visits. Getting up once or twice may appear tolerable, but for elderly individuals, it creates genuine hazards. Nocturnal restroom trips constitute one of the primary fall causes among older people. Envision this situation: you're semi-conscious, surroundings are dark, your blood pressure decreases when standing, and your stability isn't what it previously was. These combined elements convert a basic restroom journey into an authentic danger. CDC statistics reveal falls represent the leading cause of injury-related hospital admissions among seniors, with numerous incidents occurring during nighttime. The hazards extend further. When you repeatedly awaken to urinate, your rest cycle suffers disruption. You forfeit the profound, healing sleep phases your mind and body require for restoration. Persistent sleep interruption correlates with memory difficulties, heightened inflammation, and increased risks of developing dementia and Alzheimer's conditions. Additionally, inadequate rest compromises immune function and complicates managing ailments like high blood pressure and diabetes. An extra cardiovascular danger exists. When you ingest considerable water before sleep, your system must exert additional effort processing and expelling surplus fluid. This may trigger blood pressure variations and stress your heart system, particularly if you already experience cardiac issues. For certain seniors, this additional burden can provoke irregular heartbeats or more severe complications. The ideal strategy for maintaining hydration without endangering yourself requires proper timing and restraint. Consume sufficient water throughout daytime hours, but start decreasing consumption during late afternoon and evening periods. Eliminate large liquid volumes at least 2 hours before sleep. If thirst occurs before rest, consume only tiny sips instead of complete glasses. Additionally, avoid diuretic drinks like coffee, black tea, green tea, and specific fruit juices during evening hours, as these amplify urination requirements. Should nighttime rising prove necessary, guarantee your restroom pathway stays well lit and free from obstacles. Think about night lights or motion-sensing illumination to minimize tripping or falling dangers. Progress slowly and permit your system time for adjustment before standing fully. These straightforward modifications safeguard your rest, decrease nighttime incident risks, and promote general wellness while preserving adequate hydration advantages. Behavior number 6. Consuming food late in the evening. Let's examine a habit easily disregarded but carrying potentially grave consequences. Late night food consumption. For numerous people, an evening snack symbolizes a soothing tradition, a method to relax after lengthy days. Yet for seniors, this apparently harmless practice can quietly initiate a sequence of health complications reaching well beyond simple indigestion. Age-related changes affect how our systems process nutrition. Metabolic rate decreases, digestive efficiency declines, and the body's ability to control blood sugar and cholesterol deteriorates. When consuming food late at night, particularly heavier, fatty foods, your digestive apparatus must continue functioning well after you've retired. Rather than resting and healing, your system remains occupied decomposing food, potentially disrupting sleep and straining your heart and additional organs. An immediate consequence of late evening eating involves heartburn and acid reflux. When reclining shortly after eating, stomach acid can more readily flow backward into the esophagus, creating that recognizable chest-burning feeling. For seniors, this isn't simply uncomfortable, it may result in chronic inflammation, esophageal harm, and even heightened aspiration pneumonia risk if acid or food particles enter lungs during sleep. Research published in the American Journal of Gastroenterology discovered that individuals eating within 3 hours of bedtime face significantly greater likelihood of experiencing nighttime reflux and associated complications. The hazards surpass heartburn. Late evening eating can also elevate blood sugar, especially when meals contain refined carbohydrates or sweet foods. As aging occurs, our systems develop decreased insulin sensitivity, the hormone controlling blood sugar. This indicates late-night snacks may produce elevated overnight blood sugar concentrations, raising type 2 diabetes development risk or complicating existing diabetes management. A 2020 investigation from the Journal of Clinical Endocrinology and Metabolism discovered late evening eating correlated with elevated blood sugar and insulin concentrations the subsequent morning, particularly among older adults. A concealed cardiovascular threat also exists. Late eating may cause blood pressure to stay elevated during nighttime instead of decreasing as it should during peaceful sleep. This non-decreasing blood pressure pattern connects to increased heart attack and stroke dangers, especially among seniors. Heavy or fatty meals may also provoke arrhythmias, irregular heartbeats, potentially dangerous for individuals with existing cardiac conditions. For self-protection, provide your system adequate digestion time before rest. Target completing dinner at least 3 hours before sleep. Select lighter evening meals, consider lean proteins, vegetables, and whole grains rather than fried foods, pasta, or sweets. If snacking becomes necessary, choose something small and stomach-friendly, such as fruit, plain yogurt, or a handful of nuts. These straightforward modifications will enhance sleep quality while reducing nighttime heartburn, blood sugar elevation, and serious cardiovascular incident risks. Your system will value the rest and nighttime respite it genuinely requires. Behavior number 5. Adopting incorrect sleep positions. Most individuals maintain a favorite sleep position they use nightly, seldom reconsidering it. However, were you aware your sleep posture could quietly endanger your wellness, particularly with aging? For seniors, your selected position can significantly impact your breathing problem risks, cardiac issues, and even stroke. We'll start with the most troublesome position, back sleeping, alternatively termed the supine posture. Although it may feel comfortable, this position can generate a perfect combination of health dangers for aging bodies. When sleeping on your back, gravitational force causes your tongue and throat soft tissues to relax and drop backward, partially obstructing your airway. This proves especially dangerous for anyone experiencing snoring or sleep apnea, though even individuals without diagnoses may encounter subtle airflow restrictions. Mayo Clinic Sleep Disorders Center research demonstrates back sleeping can intensify breathing difficulties by up to 40% compared to side sleeping. The results of this airway obstruction prove serious. Decreased oxygen flow during sleep may lead to obstructive sleep apnea episodes where breathing repeatedly ceases and resumes. Eventually, this oxygen deficiency can contribute to brain harm, elevated blood pressure, and substantially higher stroke and heart attack risks. Research published in the Journal of Clinical Sleep Medicine discovered that seniors sleeping on their backs face a 22% greater risk of nocturnal cardiac incidents compared to side sleepers. The dangers don't conclude there. For seniors experiencing acid reflux or hiatal hernias, back sleeping permits stomach acid to flow more readily into the esophagus, creating silent nighttime reflux. This not only harms esophageal tissue but also raises aspiration risk when stomach contents accidentally enter lungs, potentially causing pneumonia or even esophageal cancer eventually. A neurological aspect also exists. Recent investigations from Stony Brook University showed that back sleeping decreases brain waste elimination system effectiveness by up to 63% compared to side sleeping. This indicates harmful proteins associated with Alzheimer's disease and other dementias aren't eliminated as efficiently, potentially accelerating cognitive deterioration. Sleeping on your right side isn't optimal either, as it may pressure the heart's primary blood vessels, impeding circulation and raising heart failure risk among those already susceptible. What represents the safest position? Specialists broadly suggest sleeping on your left side. This posture enhances blood circulation, supports digestion, and decreases gastric reflux and stroke dangers. It also assists the brain in clearing waste more effectively, promoting long-term cognitive wellness. If you're habituated to sleeping on your back or right side, transitioning can prove challenging. Attempt using a firm pillow between your knees to maintain spine alignment and position another pillow behind your back to prevent nighttime rolling. An orthopedic neck pillow can also assist in maintaining comfortable and safe positioning. If you experience reflux, slightly raising your bed's head can additionally reduce symptoms. Through training yourself for left-side sleeping, you can substantially decrease your nighttime breathing problem risks, cardiac complications, and even cognitive decline, helping you awaken healthier and more refreshed each morning. Behavior number 4. Sleeping in excessively warm environments. We all desire comfort during nighttime, especially with aging. It's appealing to raise heat, accumulate heavy blankets, or shut every window to prevent chill. However, were you aware that sleeping in excessively warm rooms can quietly endanger your wellness? For seniors, maintaining appropriate bedroom temperature represents more than comfort, it's security. Our systems are engineered to cool slightly during sleep onset. This natural core temperature reduction signals the brain that rest period has begun, assisting us in drifting into deeper, most restorative sleep phases. When your bedroom becomes too warm, typically exceeding 70 degrees Fahrenheit or 21 degrees Celsius, this cooling mechanism suffers disruption. Rather than relaxing, your system must work excessively, shedding surplus heat, potentially leaving you restless, turning, awakening frequently, or feeling sluggish in the morning. Sleeping in warm rooms produces consequences extending well beyond restless nights. For seniors, the dangers prove especially grave. With aging, our temperature control ability diminishes, creating greater overheating vulnerability. Research published in the American Journal of Geriatric Psychiatry found that older adults sleeping in rooms exceeding 70 degrees Fahrenheit experience up to 30% reduced slow-wave sleep, the deep restorative phase crucial for memory, immune function, and cellular restoration. Losing this vital sleep stage can create cascading health effects. Poor sleep quality connects to increased inflammation, elevated blood pressure, and compromised immunity. Eventually, these alterations can raise heart disease, diabetes, and cognitive decline dangers. The identical study observed that chronic sleep disruption from warm environments can accelerate age-related memory deterioration and complicate infection resistance. The hazards persist. Sleeping in warm rooms can also produce dehydration, especially for seniors already experiencing reduced thirst awareness. Night sweating triggers fluid and electrolyte depletion, potentially thickening blood and increasing blood clot, arrhythmia, and stroke risks. For individuals with existing heart or respiratory ailments, the additional cooling burden can trigger dangerous complications, including heart attacks or breathing troubles. What constitutes the optimal temperature for secure, restful sleep? Most specialists suggest maintaining bedrooms between 60 to 67 degrees Fahrenheit, 15 to 19 degrees Celsius. Utilize lightweight, breathable bedding. Cotton sheets represent excellent options and avoid heavy comforters or electric blankets that retain heat. If you tend toward coldness, layer blankets you can readily remove during nighttime. Consider utilizing a fan or opening a window slightly to enhance air circulation and maintain room freshness. These straightforward adjustments protect your heart, support your brain, and guarantee you obtain the deep, restorative sleep your system requires. Remember, a cool bedroom isn't simply comfortable, it's a powerful method to protect wellness with aging. #### behavior number 3. Exiting bed too hastily. Have you ever awakened during the night, swung your legs from bed, and suddenly experienced room spinning or vision darkening? If so, you're not isolated and you're not imagining situations. For seniors, exiting bed too rapidly can prove a surprisingly dangerous habit, one causing countless falls, injuries, and even hospitalizations annually. The primary cause behind this phenomenon involves orthostatic or postural hypotension, a sudden blood pressure decrease occurring when you transition from lying to standing too quickly. With aging, our systems become less efficient at adjusting blood flow and pressure during positional changes. The outcome: blood temporarily accumulates in your body's lower section, and your brain doesn't receive adequate oxygen-rich blood for several seconds. That's when you experience dizziness, lightheadedness, or even fainting. This isn't simply an uncomfortable feeling, it's genuine danger. According to JAMA Internal Medicine research, older adults with orthostatic hypotension encounter significantly elevated risks of falls, fractures, and even death. Falls represent the primary cause of injury-related hospitalizations among seniors, with numerous accidents occurring at night or early morning when blood pressure naturally remains lower and the body continues adjusting from sleep. Nighttime fall consequences can prove severe. Hip fractures, head injuries, and wrist breaks occur commonly, with recovery frequently lengthy and challenging. For some individuals, a single fall can result in independence loss, extended hospital stays, or even life-threatening complications. That's why treating this risk seriously and adopting safer practices proves so important. What can you implement for protection? The positive news involves simple nighttime routine modifications that can create substantial differences. First, when awakening, avoid rushing. Spend a moment sitting on the bed's edge and permit your system to adjust. Move your toes, flex your ankles, and take multiple deep breaths. This assists your circulation in catching up and reduces sudden blood pressure drop risks. Maintain a water glass beside your bed and consume a small sip before standing, especially if you're susceptible to dehydration. Guarantee your restroom path stays well illuminated. Utilize night lights or motion-activated lights to prevent tripping in darkness. Grasp sturdy furniture or handrails while standing and avoid slippery socks or loose rugs that might cause slipping. Wearing non-slip slippers and preventing floor clutter represent additional smart precautions. If you consume blood pressure-reducing medications, discuss optimal timing with your physician and whether dosage modifications are required. Following these simple steps can dramatically decrease nighttime fall risks and protect your long-term wellness and independence. Remember, rising slowly isn't simply about comfort, it's a powerful method to remain safe and confident every single night. ### behavior number 2. Disregarding snoring, breathing disruptions, or sleeplessness. Snoring frequently gets dismissed as a harmless irritation, especially with aging. However, what if that nighttime sound or the breathing interruptions that sometimes occur with it actually represent warning signals of something far more serious? For seniors, ignoring symptoms like snoring, breathing disruptions, or chronic sleeplessness can quietly establish the foundation for life-threatening health complications. Among the most dangerous and underdiagnosed sleep disorders in older adults is obstructive sleep apnea. This condition develops when throat muscles relax excessively during sleep, causing airways to narrow or shut completely. Consequently, breathing may cease for multiple seconds, sometimes hundreds of times nightly. Each incident reduces blood oxygen levels, forcing your heart to work harder maintaining your body's supply. Eventually, this repeated strain can produce high blood pressure, irregular heart rhythms, and substantially elevated heart attack and stroke risks. The statistics prove alarming. According to the Sleep Heart Health Study, untreated sleep apnea raises fatal heart attack risks by 30% and strokes by up to 60% in older adults. Even more troubling, nearly 40% of seniors experience sleep apnea effects, yet an estimated 80% of cases remain undiagnosed. Many individuals simply don't recognize their snoring or restless nights represent symptoms of serious medical conditions. The hazards don't conclude with the heart. Sleep apnea also deprives you of deep restorative sleep your brain requires for optimal performance. Chronic sleep deprivation may produce memory problems, confusion, and even accelerate dementia advancement. Studies demonstrate that seniors with untreated moderate to severe sleep apnea experience brain shrinkage in areas responsible for memory and decision-making at nearly triple the normal age-related rate. How can you determine if you might have sleep apnea or another serious sleep disorder? Frequently, it's a partner or family member who observes signs first: loud, persistent snoring, extended breathing pauses, gasping or choking during sleep, and frequent awakenings. Additional warning signs include awakening with dry mouth or headaches, feeling extremely fatigued during daytime, or struggling to remain awake during quiet activities. Sleeplessness, difficulty falling or maintaining sleep can also represent a warning signal. While occasional sleep difficulties prove normal, chronic sleeplessness may indicate underlying cardiovascular, neurological, or hormonal problems. It also compromises immunity and increases stress, complicating management of conditions like hypertension and diabetes. If you recognize any of these symptoms, don't disregard them. Consult your physician or a sleep specialist. Treatments like CPAP, continuous positive airway pressure, therapy, weight management, and lifestyle modifications can dramatically reduce your risk. Research demonstrates that treating sleep apnea can lower cardiovascular risk by up to 42% in seniors. Remember, snoring and sleeplessness aren't simply irritations, they're signals from your system that something may be incorrect. Through paying attention and seeking assistance, you can protect your heart, your brain, and your quality of life. Behavior number 1. Consuming specific medications before sleep. For numerous seniors, consuming medication before sleep represents a nightly tradition. Whether it's a sleeping pill to assist drifting off, a blood pressure tablet, or a painkiller to relieve sore joints, these routines may seem harmless, simply another component of winding down. However, what if this habit silently endangers your wellness? The reality involves certain medications taken at night that can produce unintended dangerous effects, especially with aging. We'll start with sleeping pills and sedatives, commonly prescribed for sleeplessness and anxiety. Medications like benzodiazepines such as diazepam, clonazepam, and alprazolam function by slowing the central nervous system. While this can assist relaxation and falling asleep, it also creates slower and shallower breathing. For seniors, especially those with heart or respiratory conditions, this can prove risky. According to British Medical Journal research, older adults who regularly utilize benzodiazepines face significantly elevated risks of falls, fractures, and even death compared to those who don't use these drugs. The sedative effects may persist into the following morning, causing dizziness, confusion, and unsteadiness, all increasing nighttime accident risks. It's not exclusively sleeping pills that can create problems. Some antidepressants and muscle relaxants, frequently taken at night, may interfere with deep sleep stages crucial for memory and cognitive wellness. Eventually, This can produce increased forgetfulness, confusion, and even accelerate cognitive deterioration. Painkillers, especially non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or diclofenac, can also prove problematic. When utilized frequently, these medications may overburden kidneys and liver, complicating your body's toxin elimination. They may also raise internal bleeding risks, especially when combined with additional medications. Blood pressure medications represent another common concern. While some individuals benefit from taking these drugs at night, for others it may cause blood pressure to decrease excessively during sleep. This may reduce brain blood flow, raising dizziness, fainting, and stroke risks. A hypertension journal investigation found that blood pressure medication timing can significantly affect nighttime blood pressure patterns and overall cardiovascular risk. Drug interactions present another concealed danger. With aging, our systems process medications more gradually, and the risk of one drug amplifying another's effects or side effects rises. Combining sedatives, painkillers, and additional medications without medical supervision can produce dangerous, even life-threatening complications. What can you implement to remain safe? First, always consult your physician or pharmacist before starting, stopping, or modifying any medication. Inquire if safer alternatives exist, especially if you're experiencing side effects like confusion, dizziness, or excessive drowsiness. Avoid unnecessary sedative medications and attempt natural sleep aids such as herbal teas or relaxation techniques when possible. If you consume blood pressure medication at night, monitor your readings regularly and report any unusual symptoms to your healthcare provider. Through being proactive and informed about your medication routine, you can protect your wellness, reduce nighttime accident risks, and ensure safer, more restful sleep. Small modifications can create significant differences in your safety and longevity. Final thoughts as we conclude: it's evident that even minor modifications to your nightly routine can produce enormous impacts on your wellness and safety. Now that you're informed about these 7 dangerous sleep habits, the following step involves taking action beginning tonight. Whether it's modifying your bedroom temperature, reconsidering your evening snack, or being conscious about your medications, every positive change contributes toward a longer, healthier life. Have you ever committed one of these errors without recognizing the risks? Or do you possess a suggestion that's assisted you in sleeping better and safer? These simple adjustments can protect your sleep, reduce your nighttime accident risks, and support your overall wellness while maintaining the benefits you require. Your journey toward better sleep and improved health begins now.